It is time for our Women's Health Tuesdays on this segment of the Mario Mukwanda Show. It is 36 after or 36 to 1 on this third day of November 2020. Today, we are going to be talking about endometrial ablation with our specialist OBGYN, Dr. Tom Mokaya, who is on the other side. Dr. Tom, how are you today?
I am all right. And how are your listeners? I hope your listeners are well too.
I'm great. Thanks, Dr. Tom. It's a pleasure to have you joining us once again. All right. So, endometrial ablation, what exactly is it?
Endometrial ablation, if I may describe it first, it's a combination of two words, endometrial
Mhm.
ablation. Now, endometrium is the lining of the inner womb. It's like the carpet that lines the womb.
Mm.
One can imagine a thick carpet that is lining the womb, and that is the lining which every month you bleed and then it shades off. And then after the periods get finished, that lining grows up again and is maintained for 28 days and then you bleed. So
Mhm.
that is what is called as endometrium. Now,
Mhm.
ablation is an English word which means to destroy or to burn or to completely remove. So
Mhm.
endometrial ablation means removing or destroying the lining of the womb. So
Mhm.
when we see somebody is going to have an endometrial ablation, it means they're going to have the lining of the womb um, removed or destroyed.
Mhm.
That's what it
So,
means.
why would women get this procedure done?
Now, the endometrium, as I said before, is the area that bleeds either every month or irregularly.
Mhm.
Now, there are women who have a lot of bleeding, and that bleeding normally could either be caused by many things. It could either be caused by the medication they are taking. Let's say patients who are taking blood thinners because they have blood clots elsewhere, they may have a lot of bleeding, or it could be because of fibroids, or it will be because of hormonal changes. And and because of the bleeding, which keeps going on and on and on, and doesn't stop because of many reasons, then after proper investigations, and if they qualify to have that procedure, then we have one gets that procedure. So it's essentially trying to
Mhm.
stop bleeding in a woman who is having irregular, continuous bleeding, which is becoming a nuisance to her because she bleeds a lot or she loses a lot of blood.
Mhm. So, how long does the endometrial ablation last for?
Now, when the lining of the womb is destroyed, when the procedure came up or when it's done, it is supposed to be a permanent procedure.
Yes.
So So there are stages that we go through before we finally decide that one qualifies for endometrial ablation. One, as I said before, one is to have been bleeding a lot, and therefore the bleeding has to be stopped. And and we need to make sure first before we do that procedure that the bleeding is not caused by cancer, what we call as endometrial cancer. So one cannot do endometrial ablation in somebody who has cancer. So we need to we need to make sure that there is no cancer. And
Mhm.
thirdly, we need to make sure that this patient has finished her family and she does not want any more children. Because in somebody who wants to have children, then you can't do an endometrial ablation because then they are not able to have children.
So, what is the difference between a hysterectomy and an endometrial ablation? Did you get that, Dr. Tom?
Yes, I think I didn't hear the question.
Okay, what is the difference between a hysterectomy and an endometrial ablation?
Very good question. Now, a hysterectomy means that the whole uterus is removed,
Okay.
and in endometrial ablation, we only remove the lining of the womb. And many times we find that it's in patients who may not qualify to have the uterus taken out, then we choose to do an endometrial ablation. So the two procedures may actually intersect at a particular stage for reasons to be done. So when we do a hysterectomy, the whole womb is completely taken out. And obviously, when the womb is taken out, there will be no periods. And some of the reasons why we do an endometrial ablations are the same reasons that we do we take out the uterus, the same reasons why we do an endometrial ablation.
So, are there any side effects of this procedure, the endometrial ablation?
Now, the endometrial ablation, once an endometrial ablation is done, there are a couple of stages at which we look at the side effect. One is during the procedure, when it's being done. Now, there are many methods in which the endometrial ablation is done. So, as I said, it's the burning of the lining of the womb. And this can be done where we use a particular amount of hot water in a particular temperature with a particular machine, or we can use laser, or we can use microwave. And all these are highly technical machines which have a very good inbuilt safety mechanisms. But once in a while, when those procedures are being done, a hole can be made in the uterus, and there can be a place where the uterus ruptures. Those are the acute side effect of the procedure. And once the procedure is done, at times we may not be able to succeed, and we may have to do it again. And there are instances where after some time, after we've burned the lining of the lining of the womb develops again, and the patient starts bleeding, and the bleeding starts again. So those are some of the side effects of the immediate procedure and long term after the procedure has been done.
So, speaking about long term, how many procedures would one require to have this completely done?
Sorry?
How many procedures would one require to have so that they no longer have to have these side
Uh,
effects like the one you just mentioned?
most good question. Most of the time, it requires one procedure. In
Mm-hmm.
almost 70 to 80% of the time, one procedure should be able to suffice. But there are instances where we have to do it again after probably 4 to 6 months, or even 1 year. And if we find that it does not work, or it has failed to function, then we proceed to do a hysterectomy in cases where this procedure has not worked. So if the first procedure doesn't work, we could go to the second one, and then we could go ahead and do a hysterectomy. Because once we do it, then the patient knows very well that they have finished their family, and they're not going to have any more children, because once the procedure is done, one cannot be able to fall pregnant because the lining of the womb has been removed.
Mm-hmm. Is it an affordable procedure to get done? Is it an affordable procedure, Dr. Tom?
Sorry, I think we're having a problem with the mic.
Yeah, the procedure, is it an affordable one?
Is it
Affordable.
Uh, I'm sorry, I think your voice has.
Is it an affordable procedure to get done?
Uh, Good question. The price, it is a relatively affordable procedure, but one has to take into consideration that they have to be admitted to the hospital, and it's an in-hospital procedure. And there's some highly technical instruments that we use that are quite pricey. And if one is covered by some form of medical insurance, that should be able to be sorted out. Or in the absence of that, one can still be able to obviously sort it out if they're going to pay cash. But it's a relatively affordable procedure because one, normally we ask ourselves, the expense that is being, the amount of money that is being used and the effect that it's going to have. So you find that some patients have been bleeding a lot, they lose blood, and they keep getting transfused all the time. And obviously there are dangers of transfusion. So it is a procedure which, if you'll ask me, the price that one pays is what the effect that it will achieve.
All right. So thank you so much for your time once again, Dr. Tom, and for the information that you share with us. And have yourself a wonderful day.
Thank you. Thank you very much for having me.
It's a pleasure. Bye bye. That
Bye.
was Dr. Tom Mokaya, a specialist OBGYN, obstetrician and gynecologist from Netcare Hospital, taking us through endometrial ablation, what it is, um, if it's an affordable procedure, and who can or should get this procedure done. For further comments, questions, queries, or suggestions, please leave them in the comment section below or send them to us on WhatsApp. The number is 061 766 0355. We will be right back.